Since 1978, the American Indian Health and Family Services has been providing a variety of services to the many urban Indians that reside in the greater Detroit area. Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Joining me now is the Executive Director of the American Indian Health and Family Services, Ashley Tuomi. Thank you so much for joining us today.
Thank you.
And you guys have been around for an awful long time, just quietly serving the medical needs of American Indians who perhaps don't have insurance and live in cities and communities where it's difficult to get care?
Yeah, and in addition to the American Indian population, we also serve other underserved populations that might not have insurance or access to health care as well.
And where are you and who do you serve and how are you able to do that?
Yeah, so we are located off of Michigan Avenue, right at the border of Dearborn and Detroit, between Lanyo and Wyoming. We're in a nice little residential area in an old Catholic church building. We are open to anybody and everybody that comes through our doors. As far as our funding, we have our majority of our funding comes from Indian Health Services, and then we have other federal and state grants as well that help us provide these services.
So if somebody has a medical need, but they are not insured and they are unable or they are not sure how they're going to be able to pay for it, they can simply walk through their doors, or are there certain criteria that need to be met?
Yeah, they just they can call, make an appointment, walk in. If they don't have insurance, we have the ability to help them apply for insurance or see what programs they're available for. And if they don't qualify for anything, we do basically use a sliding fee scale and charge a minimal visit fee for them to come in. Also set up payment plans, other things like that as well.
You mentioned that you try to help them get insurance if in fact they may be eligible. You are now an official navigation site for the Affordable Care Act?
Yep, we are one of the 4 agencies in Michigan that were granted an award from CMS to help people sign up through the marketplace and the Affordable Care Act, and also through the Medicaid expansion. People can sign up for Medicaid expansion right now. For most people, the Affordable Care Act will be open again in November for them to sign up.
So open enrollment will start again. If you don't have insurance, you're thinking you want to get some, the best thing probably to do if you don't completely understand navigation and you know, fumbling through the internet is to go to one of these navigation sites like yours.
Yes, definitely. It's we provide one-on-one enrollment assistance, and that's really the best way for people to ask questions, to look at health plans, to see what it's going to cost them, and to really get help choosing a health plan as well.
Without having to get into the major statistics, how many people are you able to help maybe each day or each week, and how has this becoming a navigation site and helping people get insured perhaps helped the community that you serve?
Yeah, so since open enrollment began last year, we have helped over 600 families get insurance, and that's really with one full-time staff member only.
Wow, so that's wonderful. Is that something somebody needs to make an appointment for if they wanted to sit down and help navigate through that site?
Yeah, appointments are best. As open enrollment comes, we'll have some sign-up clinics where they can kind of walk in, but they can call and schedule an appointment with one of our benefits coordinators who can walk them through the entire process. And
your population, I know you said that you serve, you know, whoever walks through, you don't have to be any specific ethnicity, that type of thing. Have you seen the population change over the years? You've been around for, you know, over 30 years from serving, you know, perhaps women and children more or less than single men or that type of thing?
Not so much in any gender and age, but definitely, you know, we started out just serving American Indians and Alaska Natives, and we've expanded that now into other populations, and have really seen an increase in Bangladesh and other Arab communities coming to our clinic to get services as well.
All right, wonderful, wonderful place. If folks do need medical care, or certainly if they know somebody who does and they're unable to afford it, what a great resource. Thank you so much for joining us today.
Thank you.
For more information on today's topic, you can head to aihfs.org. Today's Comcast Newsmaker was Ashley Tuomi, the Executive Director of the American Indian Health and Family Services.